Okay. Hello, I'm Katie,
I'm Michelle.
and we're going to do a little assignment today called the Getting to Know You assignment. Hi, Professor Campbell.
Hello.
We're going to ask each other a couple questions so you can get to know us a little bit better. And do you want to start?
Sure. Okay, so Katie, what issues in healthcare are important to you?
Okay, this is a big one for me. I have a couple. Hopefully, you're ready for this. The first one is access to affordable healthcare. That one is super important to me because I believe that everybody should be eligible to affordable healthcare, and it shouldn't be tied to your job. That's like so crazy to me that you have to have a certain job to be able to get healthcare. And this became a bigger issue for me recently because now that we're in school, we can't have full-time jobs because we have full-time school. And finding affordable healthcare was something that was kind of hard. Another one that's important to me is, and if you have anything to add about my answers, Michelle, you can chime in too. Okay.
Okay.
Better representation and diversity in communities that have diversity, if that makes sense. So if you're going to go to a community that is pretty diverse, you're not seeing all the nurses as like white girls or something. That's something that I'm pretty passionate about. I want the healthcare community to represent the community that they serve. And lastly, treating symptoms instead of just no, psych, rewind. Treating the underlying cause instead of just the symptoms. It bothers me when I see doctors that are treating just symptoms or like throwing a prescription at people instead of really getting down to why are you having this infection or what's going on that you can change in your life instead of just, throwing a prescription or something at it. What are some important healthcare issues for you, Miss Michelle?
Well, I would say that communication is a big deal. And even just like we're in clinical, it's clear that the team of healthcare workers are not always working as a team. So like the doctor will come in and not talk to the nurse at all about what's happening or what they think. And then the nurse tries to text them and be like, hey, what should I do? And then they leave them on red.
Mm-hmm.
Okay, so then it's like this, if everyone just could communicate, it would just make everything easier. And it's not like trying to pull strings to get like something very simple done. Like it's a simple thing that could just take a few minutes, but now it's taking a long time because no one's communicating. So I think that level of respect between the different people in the healthcare practice would just make everything run smoother. And I'm sure the patients can feel that. Like if something's off, like the doctor comes in rude or the nurse or whatever, and then no one's on the same page, it's like that just makes everything more stressful. So I think that's an issue, definitely. I think I'm going to touch on something you said about payment, like our healthcare. I'm not saying I have like an awesome solution, but I just think it is unfortunate that certain things are so expensive for people that like don't have insurance or whatever, especially if you're like a student and you turn 26 and then after that it's like your parents can't help you, but you don't have a job, and then it's like this awkward limbo, which I have been in, where you're like, okay, I don't know how to pay, but I'm in school, so it's like you have to figure out what to do, or you pay hundreds of dollars for an insurance that doesn't even have that great of a deductible or anything. It's just like
That you might not
whatever,
because you're 26 and
right, you're probably gonna be fine. So it's like and then you go with like me, I didn't have healthcare for a while because I was like, I don't want to pay hundreds of dollars when I'm probably not even going to go to the doctor.
Mm-hmm.
So it's just like a weird dynamic. And I've lived in other countries and they had really affordable healthcare, but it wasn't always good healthcare. So it's like, I don't know what the happy medium is there, but I definitely think that's an issue. So it's like something obviously we need to work on.
Yeah.
And then I would say that just, I think right now it's just really hard because now we're facing craziness with staff. Like there's a lot of understaffing, and even in the clinicals, like the nurses talk about how they are not even floating anymore, and it's just like they just don't have enough people to like travel with their patient if they need to, or things like that. And it just kind of puts a lot of pressure on people that aren't even trained in certain areas, and then they have this responsibility in something they're not trained on just because they don't have enough staff. So that's like alarming and also not fair. So I think those are big issues.
For
So
sure.
I'll ask
Ready
you
for the
a
next one?
next question.
Okay.
Are there any barriers that exist for you to succeed in this course, Katie?
Oh, girl. At first, I like gave my, this is my good student answer. And I said, no, there aren't any real barriers except for like my mind and my confidence and all that. And then I was like, hold on a second. And I took a good look at myself and how last semester went. And I said, hold on. This like generalized anxiety that I have all of a sudden is going to be a huge barrier, especially when I sat there in my final exam for med surge and had an anxiety attack in the middle of it. So I need to get that under control. We're working on it. It's pretty much there, but self-care is something that I'm really going to have to like work on, and making sure that my cup is like filled up, because I can't pour from it if it's empty, right? So that's something I'm going to really have to work on. And also just confidence in the nursing environment. I feel like coming from the dental environment, I knew what was going on. I knew it was going to happen. I pretty much could tell what the doctor was going to diagnose the patient with, or what like procedure we were going to do, and that's all great. But for nursing, I'm not really that confident because I don't necessarily know what's coming. You know what I mean? I have so much to learn. So I just have to build that confidence up and maybe just act confident even if I'm not in some senses. But what about you?
Well, also, I just want to say, I definitely don't think that you're the only one that's experiencing anxiety with this stuff, because even like a nurse I followed today was saying, she's like, I never had anxiety. And then I did the accelerated program. So it's like, it's just a lot. Like it's
Yeah.
a lot. It's full time, and especially if you're working or something. So I think that a barrier for me would be procrastinating, because that's just kind of how I've always been. I've been like, I do a lot of stuff, and then I'm like, oh my gosh, I only have 2 days, because I just feel like I have more time than I really do. So
Mhm.
I just have to like get that more organized, just
Yeah.
understanding like I need to give myself this amount of time. But I did learn how to do that better last semester, so we're getting there. And I think confidence as well, and I think that's just because it is a new environment, and
Mhm.
I have no experience besides last semester clinical, which was 1 day a week.
Right.
So it's like, I think understandable to not be 100% confident just because it's something that I'm not familiar with, you're not familiar with. So, and I think that comes just with time and practice. But I do think that that can be a barrier when you go in there and you're like, I don't know what I'm doing.
Right.
But really good advice that a nurse I followed last semester, he was like, you just walk in there and act like you just know. And then the patient will be like, she knows. And I'm like, I don't know, but everyone else thinks I know. So it's fine.
That's
So
what
it's just
I'm working
that
on.
energy, like, you're putting out that confidence so everyone feels that, and that helps create a better environment for yourself. And I
Mhm.
agree with you with the self-care thing. You can't like burn yourself out and then expect to be like 100% in anything.
Mhm.
So
That's good.
yes.
I think the masks help with that fake confidence a little bit too.
Oh,
Because my face, you can tell if I'm like worried about something, but now you just have to worry about my eyes. So
right.
as long as I can convince them with my eyes, we'll be good.
Exactly. It.
All right. So the next question is, what can the professor do to create an environment that helps keep you engaged and motivated?
So I think that just being available to talk to, even if it's something like small, and be like, hey, can we just review my last week? And like, I want to ask you a few things. That's helps just in case there's one little thing that might be setting you off or whatever, and just like kind of keeping you like over here mentally or whatever, or you're confused on something. So I think just being available, and honestly, so far, I would say organized, but Dr. Campbell seems awesome in that department. So I don't think that's going to be an issue. So I think just the availability is the biggest thing.
Awesome.
And there's tutors and a tutoring session, which is amazing because that just helps kind of keep it all in a little box for us. Like, okay, this is what we're doing. This is what we need to know. It's not all like over the place and like, wait, what? So I appreciate that. And I think it's going to be, yeah, like, so yeah, that's what I think. How about you? What do you think?
So I didn't even think about the tutoring thing, but that's a really good one to add. For mine, I kind of said that I just needed a warm, like inviting environment. And I wrote this actually before we went to clinical, and then I had to come back and change this one because I just want to say that yesterday was crazy for me, and Dr. Jackson is amazing. So she puts us in this learning environment that just made me feel really comfortable, really confident, and just positive. And I felt like a sponge today when I went to clinical, um, which I haven't felt yet in the program. So an environment like that is great, one where I can relate to the professor. But we know that we're supposed to be professional and we're going to, stay positive and all that stuff. But at the same time, we can relate to the professor and joke around sometimes if that's what we need to do. Like you said, a professor that we can just come to the questions. We don't feel like worried that we're going to feel dumb if we ask these questions. Or, I mean, maybe you just have to come out and say, like, dude, I've been slacking. If you can say that to your professor, or I'm just not getting this, and feel comfortable, that's the environment that works good for me. I know that I do have like a little bit of pride that I have to work through. So being able to talk to the professors and not feeling like, oh my God, I have to know this stuff. I don't know it. I can't ask questions. That's really important for me. So yeah, just being able to talk to those professors is good. So the next question is, tell us how you learn the best, Michelle.
I learn the best, honestly, with tutors. Like, I can go to class and take notes, but sometimes I just kind of like fade away. And then I'm like, oh my gosh, what just happened for 5 minutes? It just happens to me. I don't know. So I love having tutoring available because it's just like you can do one-on-one, or it's just smaller and just not as much like going on, and it's not a class. So it's like a different vibe. It's more chill. And it's like a second time reviewing. So
Right.
it's like, hear it and then you take it in, and then it's like just putting it further in your brain. Like, okay, we're going to go over it again. And then I would also say hands-on. So I'm really happy we have more clinical time this semester, because it's like we're actually doing more stuff and being because like I said, last semester, we only had that one day. So I'm excited because when I am a nurse, I want that like experience in my head of like, oh yeah, I remember this one clinical I did, and I did this with the patient, versus like only online or something. It just doesn't stick with me that way.
Right, exactly. Oh my
How
gosh.
about
Ours is pretty much the same. I took a quiz or whatever to see what kind of a learner I was. And I guess it's called kinesthetic, which I visually learn something. I can see someone doing it, and then I have to reinforce it by doing it afterwards. So I'm definitely a visual learner and like hands-on learner, I guess I would say, just like what you were saying. Having situations, either family, clinical, just some kind of like history with things that we're learning, works out the best for me. And it helps it stick in my head. Like, oh yeah, I remember when grandpa had da 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 da, and is attached to this disease or whatever. That really helps it to stick in my head.
Right. Yeah, it's like easier to relate it when you know how it looks on someone or something. It's like, oh yeah, that happened. And then instead of just reading it and it's just like these words, you're
Right.
like, what is it? Yeah.
Yeah. I can't even sound that out.
Right. Okay. Katie, describe your favorite teacher and what did they do to spark your curiosity and interests?
Okay. I have two. And they're both from U of M Flint, oddly enough, even though I've went to like every college anywhere. But they were both like kind of crazy, and they both did like memorable or like off the wall things. One of them was Dr. Maury. I had him for a neuro class, neuroanatomy, neurophysiology. I had him for a couple different classes. And the other one is Margie from Pathophys, because she would do these crazy examples. And that always helped me to remember things on the exam. Dr. Maury would always tell these off the wall stories of his like childhood or early 20s, how he was like a bouncer. He told us these crazy stories, but it always circled back to like neuroanatomy or neurophysiology somehow. And I could always remember stuff. This also was funny because it struck me yesterday with Dr. Jackson, the way that she is too, the stuff that she says. And I'm like, oh, it just makes the learning environment easy. It makes it comfortable. And it's just a fun way to learn. And I was actually excited for both Margie and Dr. Maury's classes, where sometimes with school, I'm like, oh, I don't want to go to class or I don't want to go to clinical. But yeah, they were really fun teachers to have, and I learned a lot. What about you, Michelle? Who was your favorite professor or teachers?
I've had a few. I would say I honestly, Margie is also one of mine.
Mm-hmm.
He, oops,
We lost
sorry, had a
technical.
phone call. Okay. She was just really helpful, and the way she taught really just stuck in my head. And I think you and I are similar with the way we learn. So just the little acronyms of things just to memorize, and then you have it in your head and it's like, oh yeah, I know what that is, because and then you memorize it. And she would let us take notes and have like a little bit of like a help, like a guide, and that helped me. I didn't even have to look at it half the time because it helped me memorize making that.
Yeah, exactly.
So, and that was awesome because it wasn't like that pressure of like you need to memorize everything.
Mm-hmm.
It's like, no, you have like a little help, but you probably won't even need it after you make it because it's already up here now. So I really like that. Another teacher was my Spanish teacher. I had her for she was Polish, but taught Spanish. So she spoke like Russian, Polish, Spanish, English, like she just was Portuguese. And she was really fun and just would show all of her travel pictures in class and just show us really cool movies. And she was just a very interesting person and always had like really awesome like personal stories to relate to what we were learning about. Mm-hmm. So just like that personality of like, I really like what I'm teaching. This is really fun information. And like, I'm excited to teach you. Like when you feel that, it's like inviting. And usually the teacher is really happy to be there, which makes it happy for everybody. So good vibes.
Yes, for sure.
Yeah.
Okay. So we're going from good vibes to not so good vibes. But what has annoyed or frustrated you in the past about a teacher?
I think what you kind of touched on earlier about like that like feeling of you don't want to ask a question because the teacher is going to be like weird towards you, or like kind of be like, I guess you could almost make it condescending would be a good word. Like where like you don't know that. I actually had a teacher say that to me when I asked a question, like, oh, come on, you don't know that. And it's like, I'm never going to ask anything again. And that's not the point. It's like, you want to be able to ask because that's the whole reason that we're all there, you know? And so that is like a very frustrating feeling when it's not comfortable and it's not that open environment where you can just say what's on your mind and learn and be better.
Yeah.
So that, I think that's the biggest thing for me. I just need to feel like I can ask whatever I need to ask without like judgment
Right. Exactly. I
or
think,
yelling. I don't like when yelling in front of people and stuff like that, embarrassingness,
mm,
because the teachers have done that too, where they like yell. And I mean, it depends what environment you're in too. So, but like just anything embarrassing or like just making you feel dumb
yeah,
when it's like the whole reason you're there is to be better and learn.
exactly.
That's very frustrating. What about you?
Um,
I'm
someone
done.
yelled at you before? Has a professor yelled at you?
Yeah,
What?
not yelled, but just been like rude,
That makes me
which
sad.
eh, but not, and it wasn't just to me. It was just like the teacher personality,
Yeah.
and it's like no, not cool. But
Yeah.
yeah. Anyway, how about you?
Well, I agree with all that stuff, especially yelling. That's crazy. But I don't like it when professors don't listen, especially right now. It's so frustrating. The last thing that any of us need, professors or students need, is for someone to like not actively be listening when I'm or somebody else is giving feedback, constructive or otherwise. You know what I mean? We're all here to learn. This is a crazy time because we're in this program, but it's also a crazy time because we're all learning what it's like to learn on the computer and teach on the computer. This isn't something that we signed up for, right? So just being more welcoming, I guess, and understanding when things get kind of crazy. Um, Hold on one second.
Okay.
And other things like if a student is bringing up something or like multiple students are bringing up something and just kind of goes unaddressed or swept under the rug. People, if more than one person is bringing it up, like it's so frustrating to have to like hear it again or for us to even like have to be like, okay, did you ask this? Because I swear I thought I asked this too and I still don't know the answer. You know,
Yes.
those types of things are frustrating. And I know we've all been through those before. Yeah. All right. Is there any other information that you want to share about yourself? I'm sure you're comfortable.
Yeah. I have to think of what I want to share.
Mhm.
I would say, let's see. I love to travel and I can't wait to do it again and not have all this weirdness happening.
Mhm.
Cause I mean, I could, but it's just not the same. And you got to like quarantine and whatever. Cause I like to, if I can travel, I want to leave. I don't want to stay in the US. I want to like cross a border somewhere. You know what I mean?
Yeah,
So right now
not
it's like, but
Ohio's
it's
border.
right, like an actual international border with like palm trees and stuff. So
Not Canada?
that,
No?
what?
Not Canada?
No, definitely not. Definitely not. Um, so yeah, I just really like to experience new things, which is another reason why I am in this program. And I'm really excited to go on this journey and start this career because I didn't even think I was going to be a nurse until like a year and a half ago. I was sitting on a patio with my friend while I was bartending and she was waitressing and she's like, "You would be a really good nurse." And I was like, "Huh." And here I am. What about you, Katie?
Well, I second the traveling thing because we had to cancel all of our trips last year and this year, and I'm so sad.
Uh,
Travel bug, like real bad.
I
Um,
know.
but some other things that I guess, put out there is I'm a little bit of an older student, and for some reason that makes me feel some kind of way. I don't know what kind of way, but I've always been like the youngest, and now I'm like old, and it feels just like a little bit about my background is we bought a house last fall, and we've been fixing it up. It was built in 1940, and we were trying to restore it back to the 40s condition, which has been interesting. We found some cool things like our mirror in our original bathroom was made in 1953 in the Cadillac plant in Detroit. So
Oh.
that was interesting. Can't talk. We adopted a new puppy the day after the election, and her name was Kamala, which is funny.
You have another one?
No, the puppy that we got, Millie.
Oh.
Yeah, she came. Her name was Kamala originally, and then we shortened it down to Millie.
Oh.
I just thought it was funny because Kamala Harris is the vice president now.
Yeah.
And then we also have an old grumpy dog named Cooper who likes to be in bed by 10 o'clock, 8 o'clock. He's 12 years old. I started off going to dental school, but I did not want to do that for the rest of my life. After like a ton of deliberation and hearing my mom since I was like a kid saying I should go to nursing school, I finally said, Mom, you're right. I said those words to her. She wanted to record me, but I didn't let her. Nursing school. And I think it's awesome. I'm so excited. I never thought I would be a nurse, and I can see why all my classmates in undergrad were going nuts because this is very stressful. But I'm super excited to meet all of my classmates. Obviously, I've already met a lot of you guys. And yeah, I guess that's all that you probably should know about me for now. You got anything else, Michelle?
I don't have anything at the moment.
All right.
No.
Well, thank you for joining us on our first
Yes.
episode of Getting to Know Us Nursing 340. Until next time.
I'm Michelle.
And I'm Katie. Sayonara, suckers.